All right, good afternoon, and welcome everyone to the My Horse University webinar. Before we begin today, just want to go over a couple of technology items with you. If you do not see the PowerPoint screen here, if it's a little bit off your screen, at the top of the page you should see a drop-down option under your View Options, and you should be able to select an option to Fit to Window. This will resize the presentation and make it so you can see the entire PowerPoint presentation. Also, down at the bottom of your screen, you should see an option for Q&A. This is a tool that we're going to be using today for answering your questions that you might have. So at any point, if you have a question, you can go ahead and pop that open, go ahead and type in your question and click the Submit button. Some of the questions we may address at the end of the webinar. And at this point, I'm going to turn it over to Dr. Christine Skelly.
Hi there. I'm glad to have everyone with us today. Hope everybody's high and dry. Over here on the Michigan State University campus, we're having a little bit of flooding issues as the result of a long thaw and some recent rains we've had. So Grand River is encroaching on some of our older buildings, so we're trying to barricade those. But I am safe and sound here with Gwen Sheely that helps do all the technology work and much more for My Horse University. So thanks for coming to this webinar. Caring for the senior horse is a subject near and dear to me. I've been lucky enough to have a few senior horses in my lifetime, and horses can certainly add a lot of value to our lives, even in their senior years. So before we get started, I would like everybody to take the poll that should be up on your screen. And the poll is, how old is the oldest horse you are currently caring for? And it looks like most of you have actually gone ahead and answered that poll. And as I'm looking at the polling results, it looks like we have a winner. 20 to 25 years of age is the horse's age you're currently managing. But we also have 23% of our participants are managing horses in their later 20s, and we even have a couple of participants, congratulations, that are managing horses that are over 30 years of age. So we've got a nice breadth for those of you guys that are managing horses in your teens. That is really when we want to start paying attention to changes that the horse may be going through due to age. So good for you for joining us. So with that, let's go ahead and get started here. Let's see. Okay. How old is old? And this is a question that scientists have been kind of mulling over for a while now. Usually we start thinking of horses in their mid-teens, so 15 years of age, as starting to potentially show us some signs of old age. But we don't really start talking about senior or geriatric horses until horses are into their 20s. And at this point, the population of horses that are 20 and over, we have maybe about 10% of our horse population that fits that category. We're seeing horses, we think we're seeing horses anyway, live longer. Owners are putting more resources into their older horses. And with the advent of senior feeds being popular, we're seeing even more more horses living on into their 20s and even 30s. If we look through history and do a quick Google search, you may find old Billy as the oldest horse, who actually lived to be 62 years of age, and I can't quite imagine that. The oldest pony, if I do a Google search, is going to be Chess at 54 years. But in general, again, about the time those horses reach 20 years of age, they should be showing some signs of age. All horses are going to age differently. So some horses, due to management, due to genetics, may start aging in their teens, whereas other horses may be well into their 20s before you really start having to change your management practices to make sure they stay in good health. Now, the chart that I'm showing on this screen is just kind of a fun chart I found at a symposium, and this chart kind of equates horse years to human years, kind of like we do 7 years for dog years. But in general, for the first year of life, a horse is equated to be about a 12-year-old. By the time a horse is 2 years old, they're around 7 years of human years of age. And then after that, for their 3, 4, and 5-year-old years, you would add another 4 years to that. And at 6 years and up, for the horse's age, you would tack on 2.5 years of human years. So if you do your calculations, a 20-year-old horse is going to equate to about a 76-year-old person. And you can do the math after that with your horses that are a little bit older than that. So what are some signs of age that we see in horses? You may notice horses in their teens start showing a little bit more gray hairs. The fatty deposits around their eyes or their bony structures of their face may hollow out. You often see a loss of muscle tone, especially over the top line of the horse. Not necessarily sway backed, but just a loss of muscle mass over that top line. Your mares and stallions are going to start having some lower fertility issues. We always say in the breeding business, you want to try to send those 14-year-old mares on their way, because you can still get them bred, but they're going to start giving you some trouble. So if you're saving that old mare of yours for the breeding shed, you need to go in there expecting that it's going to take longer to get them pregnant. There's a higher chance of early abortion in those older mares. Some of our older horses are going to start experiencing weight loss as they get older, and usually these are correlated with dental problems in the horse, and we'll talk about dental issues more in some upcoming slides. You'll also start to see some stiffness in the joints due to arthritis, and a decrease in aerobic capacity, so a decrease in the overall performance of a horse. And we'll talk a little bit more about how we handle exercise in the older horse later on in this presentation. So let's pull up our next poll. If you guys can help out with that. For this poll, we want to know, what is your biggest management concern? So as you're managing your older horses, is nutrition your primary concern? Are health issues a primary concern? The way you exercise, is that a primary concern for your older horse? Housing issues or mortality decisions? So it looks like, let's let a few more people answer the poll. Looks like nutrition and health are battling it out to see what's the major concern. And at this point, nutrition is just slightly pulled ahead of other health issues. And really and truly, it's hard to separate nutrition and health because they're going to go hand in hand. But this gives us a good idea of where we're placing our emphasis and our resources when we're working with our horses. So let's go on here. And we'll talk a little bit more about dental health. So dental health and nutrition go hand in hand because a lot of the problems we see with horses when they start losing weight as they age are because of poor dental health. And what's interesting is a lot of times poor dental health can go right under the radar of horse owners. So they may not really gather that the horse is having trouble chewing and whatnot. We'll look at some signs that'll help clue us in on that. But basically, as horses age, as a young horse, they'll start out with a bite that has a pretty large angle of incidence, almost straight up and down 180 degrees. But then over time, their teeth become more angulated, longer, more angulated, and you'll notice that their angle of incidence here becomes less and less. So it can get all the way down to about 90 degrees. The other problems that we see with older horses as they age is their enamel starts wearing down. So the surface of their tooth can actually wear down. And as they wear down their bite, they also start having more pointy or sharp edges within their dental structure. Some of their teeth may become loose and actually lead to tooth loss. And then you can also see infections and abscesses as the teeth become loose, the gums become a little looser around the root of the tooth, and you may have feed and grass getting packed in the gums, leading to infections, even sinus type abscesses. So it's recommended then that once horses start showing some signs of dental health issues, that you start having them examined by a veterinarian every or twice a year versus once a year. And that needs to be a robust examination, not just pulling the tongue over with the hand and kind of glancing and feeling the teeth, but actually using a speculum and lights and really looking at the surface of the teeth and the changes that are undergoing in the horse's mouth. So again, a lot of the problems that we see from a nutritional standpoint in our older horses are really the result of poor dental health. And it's pretty normal from the standpoint. You'll start seeing some real changes in the teeth around 15 years of age. And by 20 years of age, 25, half to 80% of the horses all have some dental issues that they're dealing with. So how do we know if our horse is starting to have some dental problems? The usual suspects, you'll see dropped feed, excessive salivation while the horse is eating. They may be a little slower to eat. They may actually, while they're eating, kind of turn their head from side to side. The excess salivation and the dropped feed usually ends up as what we call quitting. And I love that word, quitting. So we have wads of chewed up feed covered with saliva that you'll start finding around the headband.
And I'm sorry, who's Dr. Allison and Dr. Perry.
Hey,
Dr. Allison is,
One
that's the first name or
second.
last name?
The guy.
That's
the guy.
one.
Okay.
Second here,
Yeah,
we're
don't-
getting some feedback.
Paradigm went here.
Corey
She
Paradigm,
went
she's
there.
lovely.
Yep.
Oh my God, yeah, lovely. Fabulous.
They were
Good
all
job.
great. They were really good teachers.
Oh yeah, man, amazing people.
So that's the Saginaw Valley Equine Clinic podiatry lab. I know I can create.
I muted it. Hold on, no, just let me. My computer restarted. It's Judy. She unmuted, I think, for a minute. Okay, hopefully we are back. Looks like it. And so here, Chris, I think we can go ahead and get started again.
It's all set on
All
my
right,
end.
sorry about that. You may also see some problems with horses with choking, and I'm not talking about the kind of choke where a horse falls over and you'd have to give them the Heimlich, but simply as they're eating, you'll notice that they look really uncomfortable. They may actually look like they're yawning while they're chewing, and that might be some signs that they're just not able to chew their feed before they're swallowing. Other signs would be bad breath, whole grain in the manure, and then if you're bridling the horse up, they may be tossing their head and struggling with the bit, and then of course the telltale sign of weight loss. So we're going to pull up our next poll. No. And our next poll is, what's your biggest concern in maintaining your horse's weight? So are you more concerned about the horse getting too fat, getting too thin, or maybe you don't have any concerns at all? Your horse is just maintaining right at that fit figure. So it looks like from our polling here that horses getting too thin is your main concern. And again, that goes hand in hand. That's what we would expect with the aging horse. And again, a lot of their problems that they're having with losing weight has to do with dental health. So that's really the first place that you would go as far as taking care of that problem. So on to our next slide. So to monitor body condition scoring and weight in the horse, one thing that I think is extremely helpful is to body condition score your horse. And you want to do this at least every other week, and maybe even weekly if you're really having problems keeping weight on your horse, just to see where you're at. And basically, horses normally are going to put on fat on top of their neck, either side of their withers, along the crease of their top line or back, right around their tail head, over their ribs, and behind their shoulders. Now, in older horses, we may see some breeds that don't put on as much weight or as much fat around the rib area. If you have horses with metabolic issues, they may be very thin or ribby around their rib area, but have a crusty neck and poles of fat on either side of their tail head. So their fat distribution may be a little swayed due to their metabolic condition. But in general, we can use these areas to try to keep track of where our horse is at from a body condition score. And typically, I like to see older horses cat between 5 and 6 of the body condition score scale. So this would be a moderate or mid-range kind of body condition score. If you have a horse that you're worried about being too thin, then you're probably going to want to keep your horse closer to that 6 end of the scale. If you have a horse with metabolic conditions, then you're probably going to want to keep your horse closer to that 5 end of the scale. But basically, if we can keep our horse within this range, we have less chance of horses developing metabolic syndromes or colicking, and we're also putting less stress on bones as opposed to the obese horse. We definitely want them to have enough fat covering, enough weight on them to maintain their body temperature during cold weather, as well as just to have enough energy to get around. So that would be the ideal body condition score to keep your horse in. You want to make sure when you're monitoring the body condition score in the wintertime when a horse has a heavy coat, that you use your hands and you actually feel over these 6 areas to monitor fat covering. Also, we'll talk a little bit about Cushing's disease in horses, but those horses tend to have a longer hair coat throughout the year. So it's very important that you get your hands on these horses to monitor their fat covering. The other thing you can do to help you out as far as monitoring weight is using a weight tape. And these aren't necessarily spot on accurate from for a horse's weight, but they definitely will help you monitor changes in your horse's weight. So those are also a really good tool to use. And you want to be really alert for weight changes. The problem with older horses is some of these weight changes happen fairly slowly. And if you're seeing the horse every day, they may kind of slip by you until all of a sudden one day you walk out and you realize, oh my gosh, my horse has a body condition score of 4. It's ribby. It's getting too thin. So you want to have a good baseline that you're comfortable with, and then monitor your horse from there, and make it a real event when you monitor your horse. Let's see here. So, hand in hand with monitoring your horse's weight would be dietary concerns. So when we're looking at a horse's diet in general, we're looking at how much energy are they being fed and how is that energy taken up. So are they eating primarily carbohydrates to meet their energy needs? Is there additional fat in their diet to help them meet their energy needs? Also, horses have a real innate need for long stem fiber for a healthy gut, and also a psychological need to chew on fiber. So how much hay are they getting or pasture? How is that long-stemmed roughage being fed to the horse? We also look at protein, and we look at it from not just how much protein a horse is receiving, but what's the quality of protein. And when we're thinking about protein quality, we're primarily looking at how much lysine is in that diet. That's our limiting amino acid when we're feeding horses. So usually lysine content is a good indicator of the quality of the protein that's being fed. We're also concerned with vitamins and minerals, and if we're looking at horses that are primarily being fed hay as opposed to pasture, we know that vitamins don't last very long in stored hay. So it's important that they get vitamins another way into their diet. Same thing for minerals. We want to make sure that horses' mineral needs are being met. Some parts of the country may be deficient in selenium. Michigan is a selenium deficient state, while other parts of the country may actually have too much selenium in their soils. So crops grown in those countries are very high in selenium. So that's always a major concern. And then also water intake needs to be included when we talk about feeding considerations. And we'll talk about all of these here in our next few slides. So when we're looking at energy then, how much energy does an older horse need? Well, if you're still working the horse, you have to include the energy needed for work. And whether that's light work, maybe you're doing some light riding 3 to 4 times a week. Maybe it's heavier work. Maybe you're still competing with your horse. So you have to include that workload into their energy requirements. A lot of our older horses, though, maybe are more just turned out to pastures. So they wouldn't necessarily have a workload requirement, but you would be feeding them just to maintain their body weight. Horses, as they age, may have more issues with metabolic disease or predisposition for developing laminitis, either because they have Cushing's disease or they in general have some metabolic issues. So these horses, you want to make sure that from an energy standpoint that you're feeding them low starch and low sugar diets. We talked a little bit about fiber source. A horse can get fiber from a lot of different avenues, but usually we consider our hay and pasture, if possible. We would like that to be the primary source of horses getting their energy. Now, as their teeth start developing dental problems, it becomes harder and harder for horses to use this long-stemmed fiber as their primary energy source. So then you can start bringing in some other very digestible sources of energy in the form of beet pulp. Rice bran is another type of fibrous material that also gives a lot of bang for its buck. In Europe, they'll actually feed a lot of chopped hay to horses, and this may be a little bit easier for some horses to chew and digest. There's also hay cubes, depending on your horse's teeth. They may not be as good of an option as something like hay pellets. It'll be easier to chew and digest for the horse. Any grains we feed should probably be more low-starch grains. And if we're feeding a commercial feed, then if we process these grains, let's say we're crimping oats, or we're pelleting feeds, or putting them in a form that's easier to digest, that'll help the older horse tremendously. And then we can also add additional fat to the horse's diet. So most horse feeds without additional fat are going to be about 3% fat in the horse's diet. And then once we start adding fat on top of that, now you'll see ranges from 5 to 10% in your horse's feed. Fat's a great resource because it's basically about 2.25 times more calories than carbohydrates in the feed. So by adding fat to the feed, we can actually decrease the amount of starch that's in the feed, or the amount of carbohydrates that the horse is being fed, and still get the calories that we need. Another good thing about added fat, into the diet is you'll also have more access to essential fatty acids that are important for the good health and the immune system of the horse. So another concern then would be protein, and we talked about protein sources needing to be high quality. And there's been some research that suggests that horses have a harder time digesting protein or as they get older. And then there's been, that's a little controversial, but in general, you'll usually see horses as they're getting older being fed just good quality rations. So a good quality hay, if they're still able to chew hay, is probably going to be adequate in protein. We don't necessarily want to overfeed protein because we don't want to overtax the kidney function of the horse. So feeding that dairy quality alfalfa is not necessary, but feeding a good quality hay that was harvested early, is palatable, soft for the horse to chew on, that has some protein value to it, is definitely something that you can do. Even feeding a mixed hay that is alfalfa grass mix can certainly help a horse as far as keeping weight on. From a vitamin standpoint, if your horse is out on pasture, then a lot of your vitamins are probably being met. They've got vitamin D coming from the sun, and good quality pasture is jam-packed with vitamins. One vitamin, though, that seems to be harder for the horse to produce as they get older is vitamin C. So when you look at some of the commercial rations that are developed for senior horses, you may actually see vitamin C listed as an ingredient on the feed tag. Minerals, horses may have a harder time absorbing phosphorus. You still want to keep your calcium phosphorus ratio balanced in the older horse's diet so that at least 1-to-1, but you may want to increase the phosphorus in the older horse's diet as well. So with this, let's take a poll real quick and find out what kind of feeds you're feeding your horse. So hang on a second. So what type of, how are you feeding your older horse? Is your horse primarily on a forage diet? Maybe you're including a little bit of vitamin mineral supplementation, but the horse is basically just eating hay and pasture for a all forage diet. Or are you feeding forage with a commercial hay balancer? So we know there's, it's kind of one of the newer inventions in the feed industry for horses over the last 10 years or so. But those can help out a horse that's on an all forage diet, ensure that they're still getting their vitamins and minerals in their diet. Are you feeding commercial feeds that are and forage that are not geared towards senior horses? Usually I tell people that you probably don't need to invest in a senior horse mix until you start noticing trouble with the horse chewing or putting on weight. And then are you mixing a personal grain mix or feeding a senior feed and forage? Or are you feeding a senior feed as a complete feed? And then there's others. Okay, so it looks like most of you are feeding a senior feed along with hay or pasture. So we will run with that. That's great information. And that's, again, one of the things that I would expect. Let's see here. Okay, here we go. Senior feeds have really revolutionized taking care of our older horses. I think they're the best thing really on the market, and I always highly recommend feeding a senior feed once you start seeing signs of age that might hurt the horse from maintaining their body weight standpoint. But the great thing about senior feeds is they are high in fiber, but they are usually developed with very easy to digest fiber sources. So you may see beet pulp in your senior feed or alfalfa meal in your senior feed. They're also developed to be low starch and sugar intake for the horse. So a lot of our older horses that are dealing with Cushing's or laminitis type issues, this is a great feed for them to be on. They also include added fat to help that horse with the extra calories to make up for the low starch in the diet. You'll see usually a protein typically of 12 to 14% in the senior feed, which is a little higher than most of our adult horse rations. And they'll be vitamin and mineral fortified. So really and truly, if you're feeding enough of your senior feed as directed, you probably don't need to supplement with other vitamin and mineral supplements. They're also usually processed, so the feed may go through an extrusion process, so a lot of the surface area of that feed is available for the horse to digest. It makes it much easier for the horse to chew and digest. And senior feeds can be fed along with forage for those horses that can still chew their hay or go out to pasture and graze and get adequate nutrition from that. But if horses are to that point where maybe due to dental concerns or even laminitic concerns, you need to cut down on the amount of forage they have available. These senior feeds can basically be fed as a complete feed, so an all-in-one feed source. So it includes the fiber needs of the horse as well as energy, protein, and everything. If you're as you're feeding a senior feed, you wanna keep in mind that these are very high fiber feeds. So you've got to follow the directions to make sure you're feeding enough of this feed, especially if you're using it as a complete feed to maintain your horse's weight. The other thing with your senior feeds, they can also be turned into more of a wet mash. And this would be for those horses that really just can't chew anymore. Maybe they've lost quite a bit of their teeth and whatnot. But again, senior feeds have really revolutionized how you feed horses. They're pricey, so you want to, usually you don't want to start using them until your horse really starts needing them, but they can really keep our horses around much longer than they would normally be able to stay. Water is also an extremely important part of a horse's nutritional plan. Your adult horse can drink between 5 to 20 liters of water each day, depending on the temperature outside, as well as how much exercise they're getting. Dehydration is a very common cause of impaction type colics. So you want to make sure that your horse has plenty of water 24/7. Obviously, water should be fresh. It should be available free choice, and especially for our older horses, it needs to be offered at a comfortable temperature. So we talked about dental issues. Horses are wearing away the surface of their teeth, and basically the nerve endings then of their teeth become exposed. And if they have to dip their mouth into freezing water, well, you can kind of imagine maybe biting down on tin foil. That's the way it's going to feel for the horse. So they'll start restricting their own water intake just because it's so painful to get a drink of water. That's where if you live in really cold climates like Michigan, having a heater in your water to keep the temperature comfortable can really help improve the palatability of the water and ensure that horses are drinking it throughout the cold months. So some other considerations for senior horses is housing considerations. And by and large, most experts would agree that the more you can have your horse turned out so that they have free exercise and fresh air, the better off your horse is. And for 24/7 turnout, all you really need is a simple 3-sided shed where a horse can get out of the rain, the snow, away from the wind, and even in the summer months, provides some shade and shelter from flying insects. So we want to keep that in mind. If you're housing your horse outside, you want to make sure that the surface that they're on is clean and safe. So that means you do need to clean out that 3-sided shed. You don't want it to just build up with muck and mud. If right now in Michigan we're experiencing a thaw, so a lot of our as it's thawing, we're also going back to freezing temperatures at night. So if the pastures are real icy, that can be a real problem for any horse, but especially our older horses, because once they get down on ice, it's going to be very hard for them to get back up again. The other thing you want to keep in mind in a group situation is herd dynamics. So just because your horse was boss and top of the totem pole, you know, in its early teens, he may start losing some of that social status as he gets older. He also may take longer to eat, and other horses may start interrupting his feeding. So those are all things you want to observe and to watch out for to make sure that the herd dynamics, especially around feeding time, are conducive so that your horse is getting into the shelter as well as getting enough feed. You also want to see how is the horse regulating its own body temperature. So if you have a horse that tends to be on the thin side without a lot of body fat, that could potentially be a problem in extremely cold weather. So these horses then may benefit from turning them out with an all-weather type rug on or a blanket on. You want to, if you do blanket your horses outside, those need to be checked, you know, at least once a day. I've run into several horses that have gotten caught up in their blankets, and that can be a real problem, especially for the older horse. And we want to make sure that our older horses are someplace where we can observe them daily. Those shouldn't be the horses that are turned out in the very back 40 that maybe somebody stops by and tosses out a round bale once a week. These horses need to be monitored every day to make sure that they're healthy and getting along okay. So exercise then, would be another aspect of managing the older horse. And in general then, we just want to be cognizant that these older horses, if we, let's say we don't ride them through the winter, when we go to bring them back up and put them in a conditioning program, that conditioning program is going to take longer than it did to get them legged up for work. Say a horse that's 10 years old. So we want to give them plenty of time for a conditioning program. And, you know, in general, we want to try to keep those horses fit throughout the year instead of giving them a really long rest to where they can lose conditioning, because they will lose their conditioning faster than a young horse. Our warm-ups and cool-downs are going to take longer with our older horses. We want to spend a lot more time at low intensity work during the warm-ups, doing a lot of flexion type exercises. And we also want to give horses longer to recover after exercise. So even during our cool down, that's going to take quite a bit of time for them to recover their respiration rate and their heart rate. Overall, because their cardiac output isn't as robust as it was in their younger years, overall, we're probably going to see a decrease in the intensity and the duration of their work. Some of the maneuvers that were really easy in their early years are going to be maybe not quite as fast and proficient due to arthritis. You want to make sure that you're giving them plenty of rest between maneuvers as you ride them. So in general, riding our older horses is a great thing. Keeping them exercised. We just want to be very consistent as we do it. We don't want to have long periods of layoffs and then start right back up where we left off. We're going to have to gradually get them back into exercise and just understand that we're probably not going to be able to ride them as hard or as long as we did when they're younger. And I think the biggest take home is you really need to listen to your mount. So when I'm bringing up my older horse to ride, I always lunge him first, and that's primarily so I can watch him move, see some days he'll just be bucking and very collected as he's loping around me. Other days you can see that he's just a little stiffer in his hocks. So on the days that he seems a little stiff, not quite as flexible, those are days that I may just do a lot of walk and trot work, a lot of flexion type exercise. I'll save my cantering for a day that he feels a little bit more relaxed and more fluid. So again, listen to your mount, know the signs of stiffness and lameness. It may be helpful if you have a horse with a lot of arthritis to give them a little bit of bute before your exercise, but you want to be cautious that you don't do that too much from a long-term health standpoint. So that we've got one last poll actually that we'll bring up, and that is what health concerns are you currently managing in your older horse? So do you have concerns with arthritis, Cushing's disease, metabolic syndrome, respiratory disease, or other? So it looks like, and this is exactly what we would expect, looking at the research, clinical research, but arthritis seems to be one of the major concerns, and then we have Cushing's, respiratory disease, and others. Great. So yes, most of our older horses are definitely going to experience arthritis, as it just comes hand in hand with getting older. There are some factors that may contribute to arthritis, and that would just be the horse's overall conformation. So that's one of the reasons that we learn how to select horses for correct set of feet and legs, is just to try to have horses that are going to be able to maintain their soundness a little bit longer, or their usability a little bit longer. Horses that were used for very intense sport, your race horses, cutting horses, reiners, dressage horses, jumping horses, roping horses. These horses are all putting a lot of stress on their knees, and especially their hocks throughout their career. So just through use, then you're going to see they may be more prone to stiffness as they're getting older. Horses that have had some leg injuries throughout their career, also those sites of injury, there may be some articular cartilage type damage that occurs. And again, just age itself is going to be a factor. And actually, arthritis is one of the leading, lameness in general is one of the leading concerns that vets see when they're working with the older horse population. So other issues or management of arthritis would be, again, using drugs like bute to help manage the pain, but working with your veterinarian and how often and the amount that you use bute is well advised. Keeping your horse active, keeping your horse outside where they have free turnout, riding your horse consistently, 5 days a week versus once a week, modifying your work so that you're not overstressing stiff joints. All of those are part of the management routine of the arthritic horse. From a treatment standpoint, when you start initially seeing some stiffness of joints, usually in horses in their early teens, if it's age related, you can start treating them or supplementing with glucosamine chondroitin sulfate. That's actually one of the few nutraceuticals that, if given at the correct amount, has shown some joint improvement in many species, but the horse as well. So that would probably be the go-to there. You do need to understand, though, that for glucosamine chondroitin sulfate to work, it needs some articular cartilage left in the joints to actually work with, so it'll help lubricate that cartilage that's in the joint. But as a horse gets extremely old and they wear out that cartilage, there may not be enough cartilage there for this supplement to actually have an advantage with. So you kind of want to monitor that. I've talked to a lot of people where this supplement has really extended their horse's career, and they felt that it had a real positive effect. Some people will use acupuncture and chiropractic treatment and even massage therapy to help these horses through that are sore. And they're when done correctly by certified practitioners, these can be beneficial as well to the arthritic horse. Cushing's disease is medically also termed pituitary pars intermedia dysfunction. And basically, it's where the pituitary is getting dysfunctional, and you're seeing a lot more stress hormones being produced by the horse. And most horses, as they're getting into their 20s, mid-20s, may start showing some Cushing's type symptoms, such as a long shaggy coat that just doesn't shed even in the summertime. They may seem tired, have excessive drinking and urination, very excessive sweating. 50 to 80% of these horses that have Cushing's disease will probably experience some laminitis from that, and you'll also see some loss of muscle mass. There is a test where you can positively diagnose for Cushing's, and that is the dexamethasone suppression test. But a lot of times veterinarians may just look at a horse, and if you look at this one horse with his sway back here, he's kind of textbook as far as looking like a Cushing's type horse with a shaggy, dull hair coat. So oftentimes if they have a horse that they highly suspect is Cushing's, they'll just start out, if the owner wants to treat them with pergolide, they'll just start out with the treatment, and if the horse responds positively to that treatment, then that's pretty much a positive diagnosis of Cushing's. For a horse that's experiencing Cushing's syndrome, you want to feed them basically like you would a metabolic syndrome type horse. So actually the senior feed that we talked about that is low in starch, low in sugars, is a great feed to have this horse on. You want to watch the sugars in their forage intake. Some of these horses may have to have restricted pasture access, so you could use a muzzle even to help with that if you wanted to keep them outside most of the day. And then in the summertime, you want to body clip your horse just to help them with their heat regulation. Another issue that horses may have are respiratory airway obstruction, also termed as heaves. And this would basically be like having asthma or bronchitis in a person. So some signs of heaves would be increased respiratory rate, just standing still, labored breathing, coughing. Horses, due to the labored breathing, may develop a heave line through their barrel. And these horses really won't be able to withstand exercise very well at all. So those are some signs. From a treatment standpoint, you want to decrease their exposure to allergens. So that's where outdoor housing really becomes a benefit, because one of the ways horses are symptomatic is exposure to moldy or dusty hay, or just the dust from living inside. Straw bedding or dusty arenas can all antagonize this condition. So being able to get them out of that environment can be very helpful. If you need to feed hay, you can wet the hay down. That's also helpful in decreasing the amount of dust associated with hay intake. You can treat horses with heaves with corticosteroids or bronchodilators. Those are all beneficial. And we also have melanomas or carcinoma that may come about with our older horses. And basically, your squamous cell carcinomas, risk factors would be age and lightly pigmented skin. You may see these lesions around the eye, lips, nose, genital area of the horse. Melanomas are going to be a little bit more of your larger surface tumors. Horses that are gray in coat color are much more likely to get melanomas, and about 80% of your gray horses will develop these tumors as they age. And in the mare, if you lift up their tail, you may see some tumors around the vulva area. They can be actually even underneath. So as far as treating these tumors, you want to just keep up with them with the veterinarian. A lot of times people may, if they're not bursting open or anything, they'll leave them alone, but there's probably some rationale for removing them as they occur because they can tend to spread. So if you want to learn a little bit more about melanomas, visit our My Horse University blog site. I had a gray mare growing up, and we went through the whole rigmarole of having an eye removed, having tumors removed around her, but she lived on into her 30s as well. So in general then, just to kind of summarize, for our older horses, it's really important just to practice good general health care. Don't take any shortcuts just because maybe you don't ride them anymore. They're just out to pasture. They still have to have their annual vaccinations. Michigan just went through a rough year with West Nile virus and triple E in our state. All of the horses that
apologize for you.
died from those
They're much better off having you than me because you
were unvaccinated. So again, it just kind of brings home the point: you've got to vaccinate your horses. No matter how old they are or how much you use them, they still need to be vaccinated. You need to practice a very robust parasite control program. You still need to maintain their hooves. Just because they're out to pasture, not working for us, they're still going to need hoof trimming on a regular schedule. Again, you want to monitor their weight at least twice a month. And you need to do it even recording what their body condition score is and maybe what the weight tape says will help you keep track if they're gaining or losing weight. You want to feed these horses to maintain their digestive health and body weight. And there's some great products out there. You can work with your vet, with your nutritionist, when it may be time to switch your horse over to a senior feed. And you want to observe these horses on a daily basis. Basically, you just can't take any shortcuts with these older horses. They all are going to need some help. So with that, I see our lunchtime webinar has timed out, but I am going to take a look. It looks like Dr. Martinook has been helping out with the questions, and thank you very much, Judy. I'm looking at a few of the questions on my screen here. Let's see, one from Crystal. When you notice the grinding surface not working as well, should you continue to feed regular hay, chopped hay, or switch to soaked feed right away to avoid choke, etc.? Crystal, on that, You could definitely go to a chopped hay or soaking your hay first. I think I would also look at the type of hay I'm feeding. So I, again, want to feed a real palatable hay if the horse is starting to have trouble with eating hay. And probably would go that route before actually changing to a different type of fiber source. But if that's not working then for you, then probably going to your senior feed or maybe soaking beet pulp would work. Horses don't necessarily choke very easily, so monitoring that, if you don't see signs of actual choking, that probably wouldn't be my first concern. My first concern would be that the horse is just getting enough calories, so I want to make sure that whatever they're eating, they're able to digest it. Let's see, Denise, one of my horses has 2 teeth missing. What is the best option for feeding forage? He is also on pasture. Well, actually, pasture probably is the best option for feeding the horse forage, as long as it's long enough that he can grab hold of it with his molars, but that'll be pliable. Other than that, you may want to look at chopped hay or even hay pellets. Let's see, I own a plus 30-year-old mule. This is from Kim. Is body condition scoring the same as for a horse? And in general, yes, it is. But I'm sure that there's some unique aspects of that. We actually have a webcast on My Horse University that is about care of donkeys and mules, and I would suggest maybe you read that. But in general, they are gonna put on fat very similar to horses, and they can definitely get overweight pretty quick. Let's see. Crystal, any studies, etc., on risk to the foal from breeding a senior horse, such as instance of Down syndrome, etc., in humans? Crystal, that's a great question, and no, I don't know of. I did see one study where it said that older stallions may be more prone to have cryptorchid foals, but I'm not sure that was a very robust study or information. It might be fake news for all I know. But I think in general, though, you want to make sure that that mare is going to be able to care for her foal. And so, one of the problems we have with older horses is keeping weight on them. A mare, when she goes into lactation, is going to need about twice as much energy as before to maintain milking capacity for her foal. So that's one problem that you might see. I know that I foaled out a first-time mare, and she was in her late teens, and that was the first foal that I'd actually had to help really pull out of that mare. And I think she was just a little maybe too old for her first foal to come into play. So all of those things, you may want to wean that foal off early from that mare as well, so to let her get back on track. But yes, no other issues that I know of on that. Let's see here. I think it looks like Judy has probably answered Kim's other question there. So I think that concludes our webinar. If you have any questions about the older horse that we didn't get to, if you want to go to our Facebook page, you are certainly welcome to ask those questions on My Horse University Facebook, or you could go to our website and go to our blog site, and there's a place for comments on the Remembering Blue blog. You can post your questions there and we will definitely get back to them. So we really appreciate your attendance today, and have a great day and good luck with all your older companions.